Assalamualaikum warahmatullahi wabarakatuh. Okay, welcome back again. This is the part 2 about our osteoporosis. This topic we will go a little bit details regarding the physiology and morphology of human bones. Okay, so bones are made of collagen and mineral component. Okay, which is it's become hardens, okay, as we get old or become an adult, and the collagen that give the flexibility, okay, and which they give an impact absorbing capability to our bones. All right, so if you can see of your own bones, you can see that we have some part of the collagens, okay, and some is the hard bone. All right, so the bone itself is just not built up by the calcium itself, it's a deposited with other type of minerals that give a stiffness and strengthen the bones. Okay, so imbalance of these components can reduce the bone strength and quality. All right, another part regarding human bone I would like to share to you about is that the more, okay, you use that any particular area of the bone, let's say you are some martial artist or you work hard on the certain part of your bone, that particular area will become more hardened as compared to other part of the bones. Okay, there will be more mineral deposited together with the formation of the new bone around that area. Okay, skeletons is composed of cortical bones, which is what we call as a compact bones, up to our 80%, with some tubercular one, which is the rest is about 20%. And this amount of the amount of these bones are varies depending the size of the bones. Okay, this is again the percentage and the area of the hardness is varies compared on our daily activities. Okay, and even a type of job. Alright, so a few definitions that we need to understand before we go deeper. One, we need to understand what is bone density. Alright, so the bone density defined as referring to the amount of mineral meters square, okay, per centimeter of the bones. Okay, the more of the bone that show you have the high dense of the bones. Alright, so if there's less, then it could be like more brittle. Okay, so lacks of mineral, it become more brittle to, on that particular region of the bone. Okay, next is the bone strength. We are referring to the bone quality and the bone mineral density, which is we call as bone mass. But the last definition here is regarding about bone remodeling. Okay, this is a continuous process. Okay, bone remodeling is like a continuous process that our cell build up the bone, okay, occupying the dead tissue, okay, replacing with the new bones. One another things that we use the bone remodeling is also if you have an injury, okay, and then that process reconstructing the bone, this is also called as bone remodeling. But for these cases, okay, sorry, for this case we focus on bone remodeling, referring to the remove, okay, of the old skeleton or all the cell, okay, what we call it as resorption, and the build up of or the synthesis of a new tissue that form what we call as ossification. Okay, so I also love to show you how the healthy bones look like. Okay, you referring to this diagram, this is showing the healthy bones. Okay, this is the bone that already undergoing for osteoporosis. You can see that this is very small pore that exists. Okay, this is showing the good bone density and have a high bone strength, as compared to this one is more like more pores and it become more brittle. Okay, so this type of the bone are prone to fractures and so on. All right, so next, after you do understand but a little bit regarding our bones, we want to focus on osteoporosis. What is osteoporosis? Okay, this is referring a progressive bone disease which characterized by a decrease in bone mass and bone density, which at the end or eventually lead to risk of bone fractures. Okay, bone fractures can be anything due to work, okay, and so on. But we will go in detail on that because all of this we will have three type of bone three type of osteoporosis. Okay, so three type of osteoporosis. Number one, what we call as postmenopausal osteoporosis. Second, age-related osteoporosis, and lastly is the secondary osteoporosis. Okay, by the first name of it is postmenopausal osteoporosis. But the name itself is mainly referring to the female or woman, and they encounter the particular of osteoporosis type of disease after they reach their menopause. Right? So the second is age-related osteoporosis, and this one will be go for both. Okay, gender, male and female. Alright, due to certain age. Okay, you have produced less amount of hormone that which is the reabsorption occurred more than process of ossification. The third type is the secondary osteoporosis. This is could be due to an accident or something like that, or you're undertaking certain type of treatment that cause a reduction of synthesis of bone cell. Okay, by referring to the definition of osteoporosis, referring to the decrease of bone mass and density and so on. Okay, so what bone loss occurred when the bone formation is less compared to bone reabsorption. For example, let's say that we have bone formation. Let's say this is for example, right? Okay, they build up 10 new cells, okay, and the bone reabsorption is occur at the rate of 3 cells, so we have surplus of 7. So that's why we have more bone formation, okay, which is you're not within the osteoporosis process. But later, when the bone reabsorption, the value is higher or greater than the bone formation, then we start undergoing for osteoporosis. Okay, for male and female start to lose bone mass in their third and 40th decade, which is when they reach 30 and 40 years old. Okay, this one mainly focus on the age-related osteoporosis. Okay, for the postmenopausal, okay, the unit is that is occurred when a woman start to facing their already entering their menopause, in which the estrogen deficiency occurred, and when there is a less of estrogen, so it will increase the bone reabsorption. Later we will go through how estrogen is play a vital role in preventing or slowing down osteoporosis. Okay, men do not undergo a period of accelerated bone reabsorption similar to menopause. Alright, for the female, they can have both. Okay, for the male, not usually, we only have age related, but we put this aside lah. Okay, because this one is regardless, the secondary osteoporosis regardless of gender. Alright, male osteoporosis is multifactorial. Okay, secondary causes and the aging are the most common contributor for the factors, such as men are more like physical labors. Okay, this is general. Okay, general like in the construction and so on. Okay, so they are prone to have secondary osteoporosis in terms of accident and so on. Alright, so this is the first category. Just now we discussed postmenopausal osteoporosis. This is generally developed after menopause when the estrogen levels drop, okay, significantly. Okay, this is when the osteoporosis become more accelerated, okay, especially among women. Alright, and this occurs that changes lead to the bone loss, usually in the tubercular spongy bone area inside the hard cortical bones. Okay, and up to 20% bone loss is occurred within 5 to 7 years after the menopause. That means how severe this case. Okay, within 5 to 7 years after menopause, okay, it's occurred accelerating. Okay, 1 in every 2 women aged over 50 will have an osteoporosis related fractures in their lifetime. So 1/2, which means 50% of the women world population, after they reach the age 50, they will facing this particular problem. Okay, second type, age related. This is the main cause for both gender, okay, due to body hormone production, just like women, which is less produce of estrogen. Okay, but men, this is due to our less of testosterone. Alright, women over 50 and men usually over 70 have an increased risk for osteoporosis due to the drop of the hormone. Okay, age-related osteoporosis, okay, occurred due to hormone lack of hormone production, calcium, vitamin D deficiency, and these are mentioned, okay, cause accelerated bone turnover and reduced osteoblast formation. Okay, this is for the secondary age-related osteoporosis. Okay, so this is a diagram showing how it look like. Okay, this is in the normal situation, especially for women. Okay, doesn't matter if it's postmortem or age-related osteoporosis. When the estrogen is high, what happens there? Estrogen block, okay, stromal cell production of inflammation cytokines, and osteoclast proliferation and lifespan is reduce it, okay, and reduce the RNKLs. Okay, these are two compound that triggers, or I would say that accelerating the bone reabsorption. Okay, when the hormone is lack, okay, this is what happens, that less estrogen, what occurs that all of these compound become increased. Okay, osteoclast, high activity osteoclast bone reabsorption, increased inflammation, produce a lot of cytokine, interleukin 1, 6, and tumor necrosis factor alpha. Okay, and this also promoting metastatic tumor progression in the bone. Okay, so you see that the importance of estrogen, okay, especially for the woman. Okay, that's all for this particular short topic video regarding tree. Okay, please remember what are the bone, okay, what's bone density, bone mass, bone loss, okay, and three type of osteoporosis. Number one, postmenopausal. Number two, age related, and the third is secondary osteoporosis, which is caused by accident or treatment and so on lah. Alright, so this is the last one about secondary osteoporosis. Alright, usually can caused by medical condition, okay, accident and so on. Okay, and I love to mention to you is that in terms of medical condition such as drug-induced osteoporosis, which is systemic corticosteroid, okay, where when you take prednisone more than 7.5 milligram per day, okay, thyroid hormone replacement and anti-epileptic drugs, and all of this, okay, will trigger to secondary osteoporosis for a long term use of these particular drugs. Okay, right, that's all for this topic. I hope to see you for the third video. Okay, the third video we will go deeply in detail how to treat osteoporosis or to delay the process. Okay, thank you.